Breaking news. Man loses his life savings after getting sick in Cambodia. Oh no! Don't let this happen to you. And you know what? After this video, it won't, because I'm going to share with you 2 different healthcare plans that I personally applied for, how much they are, what they cover, and how this can benefit you. Because being an expat, you do not want to be moving to Cambodia until you know the cost of healthcare. Okay, I think the first place we need to start, before I get into the comparison of the 2 healthcares, because man, it's really good, so you want to watch till the end. But we need to first understand, you and I, how much is healthcare in Cambodia in general? Could you maybe possibly afford some of the out-of-pocket expenses that you would maybe not need insurance for? So I did a little digging to help you and I out, and here's some of the information that I came up with. And of course, I got my trusty little laptop here. I wrote everything down, but I'll try not to make it boring. So let's go. All right. Now, if you want international standard hospitals, they mostly operate in Phnom Penh, which is where I'm at now. Now, I know there's a lot of fans, maybe you, that actually prefer to live in Siem Reap. It is cheaper than Phnom Penh. I totally agree with you. However, the international hospitals, if they're, I don't know, I haven't researched, correct me in the comments, but I think the majority of the good Western international hospitals are going to be here in Phnom Penh. So keep that in mind, okay? You know what that means down the road. If you get sick and you're in Siem Reap or you're in one of these rural areas out in Cambodia, you're probably going to have to somehow get to Phnom Penh to get treatment. Just saying, keep that in mind. All right, so now, these are the international hospitals, like the one here that is, I think is really nice. I haven't been in it personally, thank God, but I've driven past it. It's all glass, it's multi-level. It's called the Royal Phnom Penh Hospital. It is super boss looking, that's all I gotta say. If I was sick, that would be the hospital I'd wanna go to. It is considered a private hospital, okay? Now, there are public hospitals that you can go to, which are free actually to expats. Some expats do qualify, and you know, that sounds great, but they're understaffed, they're underpaid, there are long wait times, and they have substandard service, which means they may not have the necessary medical equipment that's modern enough to take care of you. I don't think I'd want to trust my life into a situation like that. You know what I mean? Okay. So the next thing I wanted to go over with you is that the actual out-of-pocket expenses, if I can speak. So how much is it? Well, for expats, a routine doctor visit typically costs anywhere from $5 to $100. Out of pocket. That's a doctor's visit. That's not bad when you think about it. Emergency costs, though, is where they get you. And it says if you actually need to evacuate, let's say that you have a heart attack. Okay, let's just throw a scenario out there. You have a heart attack, God forbid. They can't treat you at the Royal Phnom Penh Hospital because they don't, you know, they just lack the necessary equipment to help you. So they got to evac you over to either Thailand or Singapore. Do you realize how much that's going to be? And this is out of your pocket. If you have no insurance, it is $10,000 to $20,000 to get evac'd out to Thailand or Singapore. I don't know about you, but I ain't got 10 or 20 grand sitting around. I mean, maybe I could squeeze it on a credit card, but then you got to pay it back. That's a big chance to take. Now, dental care routine checkups are pretty reasonable. Checkups are anywhere from $15 to $25. Not bad. Me personally, when I was in North Macedonia, in Europe, I had my teeth cleaned and it cost me $38 out of pocket. So 15 to 25 is pretty reasonable. And if you need to get like a crown, it's about $150 to $650, which that is the reason a lot of tourists come out here to get their teeth done. It's cheap. Now, what classifies as serious conditions? Well, let's go over them. Severe trauma, like cardiac issues, right? Cancer, that's another thing. So just think of those. And another thing is, you can get international health insurance online through companies like Cigna Global or Alliance, and they fall under this one quote that I'm about to share with you here very shortly. But we'll go over that in a minute. But now I wanted to go over about prescription drugs out here. I did not know this. Okay. Counterfeit drugs are also common in Cambodia, believe it or not.
What?
They recommend that you stick to larger pharmacies and ones that are more reputable and well known. And one of them is called U-Care. Okay, I'll put it right here. It is well known, and they give you the real stuff. Okay, because here's the thing. Cambodia does not recognize doctors' prescriptions. They do not give a flying F, if you know what I mean. They will literally just hand you the drugs. Like I said, I don't know, I may be wrong, like I said, correct me. I haven't actually personally had to walk up into a pharmacy and ask for like Xanax or something. But that's sort of a double-edged sword, because let's face it, if you're hooked on Xanax, right, and you don't need a prescription, and you can just walk up into a pharmacy and say, yo, do you have any Xanax on the back shelf? And they're like, yeah, how much do you need? Give me a whole big ass bottle. Okay. That's dangerous. It's good because you can get it without a prescription, but it's dangerous because you can get it without a prescription. So like I said, double-edged sword. Next thing is a lot of the counterfeit drugs that are sold in all these other pharmacies. Now, there are a lot of pharmacies in Phnom Penh, okay? I ain't gonna lie. There's actually just whole streets dedicated to pharmacies, like one after the other. You got XYZ pharmacy, PBQ pharmacy, Cambodia pharmacy. Like, they're all smack right next to each other. You can just pick whichever one you want to go to and walk in and get your drugs. Now, the ones like I mentioned, the U Pharmacy, now they're in like the big Western malls. They're scattered throughout the city. And I mean, if it's me and my body, I want to know that I'm putting in a decent pill that wasn't made somewhere in the backyard. You know what I mean? I'm just saying. Okay, let's go over how much are the prescription drugs out here. Okay, I'm going to give you just an example. Like amoxicillin. You know what amoxicillin is? It's like, I think it like kills a virus or something like that. Oh, it fights infections. Okay. Well, in the USA, a pack of amoxicillin is $75. Okay. A pack of it here in Cambodia is $2. That's a big freaking difference. So now you know the cost is really cheap. But the reason they don't recognize prescription drugs out here is because there's a lack of price regulation. They don't have that system in place in Cambodia. So 75% of your prescription drugs are going to be out of pocket anyway. And you know, you want to go to a reputable pharmacy because like I said, the quality matters. If that pill is lacking any type of sufficient active ingredient, then you are really taking your life into your own hands. I don't care like If it's $2 for amoxicillin at the U pharmacy, but it's 50 cents at the XYZ pharmacy, I'm going to the U pharmacy. Okay, now let's get to some of the juicy shit, okay? Because I know you've been waiting on this. I went online to a site called Pacific Prime. Pacific Prime is like a brokerage firm where they give you quotes from multiple health insurance companies, okay? So I thought, you know what? Let me plug in my demographics. Let me see what they quote me. Because I thought, oh, I'd probably get a really good rate, you know? So I'm just going to share my demos with you, and I'm going to share the amount that they actually wrote back to me, which blew my cookies out of the water. I was like, are you kidding me? So anyway, I'm not going to lie about my age. I'm 55 years young. I have no pre-existing health conditions. I have no current health conditions. I'm not on any drugs, legal or illegal, okay? And I don't drink alcohol. I'm like the straightest edge you will ever meet. Like, I eat clean, I exercise. I feel like I'm in really good shape. I think I'm in the best shape of my life right now. So I thought, oh, I got this in the bag. I'm gonna have a really great quote, because what I was looking for was to pay no more than about $50 a month, right? Easy peasy, maybe $600 a year on health insurance. Because I need it. I don't have any right now. I know that's terrible. So I wrote the guy wrote me back, and he's like, and this is through, okay, the first quote, this is the cheapest quote through Yumi, which I will share with you, $171 a month with a, well, let me tell you, with a $10,000 deductible. What? A $10,000 deductible and $171 a month. I about lost my shit when I saw that. And it doesn't even cover emergency reparation. You know what I mean? And if you don't know what repatriation, what the hell? Whoops. Repatriation. It does cover emergency evacuation, but not repatriation. And what that means, if you're not familiar with that word, which I can't even pronounce, is that, like, since if you're a US citizen and you gotta be sent back to your home country for more treatment, they send you home, that's repatriation. That's what that means. Yeah. So then I was like, okay, and that was through Yumi Insurance. And then I looked at another one he sent me, it was through Now Health Insurance, which is sort of a big thing out here. And this one actually includes repatriation, blah, blah, blah. But it's $191 a month, okay, with a $10,000 deductible. Now, mind you, this coverage is $1.5 million in medical expenses. The other one, the cheap one, was at $1 million medical expense. And I was like, I don't need all that. Like, I mean, at the most, what do you think? 20,000 to evacuate if you needed it. And if I actually needed a surgery, I don't think it would come to $1 million, especially in Southeast Asia. Oh, and here's another kicker. This plan, or these plans, exclude the United States. In fact, most of them that I looked up do not include the Americas at all. So they're like, no bueno. So if you go back to your home country like me, I like to travel back to see my kids every couple of years. And let's say in the time I'm there, something happens to me, that insurance will not cover me. I am screwed. I'm just with no health insurance again. So what's the point? And besides, with me living on my pension out here, which is $812 a month, my expenses all in are about $700 a month. I only have $100 left over. I don't have enough to cover $171 a month. Like, that's out of the question, obviously. Well, here's the good news, guys. You don't have to pay $171 a month. You don't have to pay over $1,000 a year to carry health insurance in Cambodia. A newly acquainted good friend of mine, her name is Sherry. Shout out to Sherry from Canada, whom I just met, one of my YouTube fans. She bought me a coffee in person here in Phnom Penh last week. She turned me on to a place called Safety Net. I don't know if you can see this, Safety Net. And she told me that she got a yearly premium. She's 56, so she's 1 year older than me, and she got it for $800 some a year. And she got like a really good plan. So I said, oh my God, that is way cheaper than what these quotes I've been getting online. So I said, you know what, let me check it out. So she gave me the name of the lady. Her name is Aline, A-L-I-N-E, I'm sorry. And I met up with her the other day. But first she emailed me, we were going back and forth. I told her, hey, look, I'm 55, blah, blah, blah. I need health insurance. I don't need dental. I don't need maternity leave. I don't need any of that. So she writes me back, and I'm about to show you. Now, oh, by the way, Safety Net is, this is health insurance specialists, but they're sort of like, what do you call, like an agent, and they work directly with this insurance company, Forte. They underwrite it, Forte General Insurance. They are actually a Cambodian-based health insurance provider. So not only do they provide health insurance for Cambodian people, but they provide it for expats too. I did not know these people even existed, and I'm so glad that I was turned on to this. And this is the information that I feel that you need to know, because this is need to know information, all right? Okay, let's go into, before I tell you how much I'm paying, I'm still, I gotta pinch myself because I can't believe how cheap it is. But anyway, and it's good coverage. All right, it's considered private health insurance. Now, what's the eligibility first, okay? Entry age, you must be under 60 years old when joining, and you gotta be under 80 years old when you switch from a similar plan, okay? There's no limits for renewal. Now, you can't have, here's the kicker, you can't have any history of any listed conditions, such as cancer, diabetes, and a few others as described. Now, we'll go into that a little bit more detail because there is a clause to that, so don't shy away from this. The other thing is your BMI must be below 35. So I hate to say it, but, and no disrespect out there, people, but if you're a fat ass, you're not going to get this health insurance, okay? So I would recommend that you start working out and getting your ass in shape before you get to Cambodia for many, many reasons. One of them, to get this health insurance. Okay, let's move on. Now the benefits that I picked it's called the standard plan. Sherry got the standard plus plan, which is a little bit higher coverage. I opted for the lower one. My annual benefits are gonna be, let me see, $100,000 annual max for accident insurance. Accident annual max, $100,000. Illness annual max, $50,000 for the year. Let me see, and this is considered, yeah, and then, okay, let's say hospital, inpatient and day patient hospital treatment. I'm gonna go over all this stuff for you. All love this shit. So anyway, for a room plus a meal plus basic nursing, they will pay $50 a night on my plan. On hers, it's about $80 a night. This is what they quoted under my age and my conditions. Hers might be different, but I'm just saying this is how they gave me both of them. So if you want to go higher on the coverage, it would be $80 a night. I picked the 50. What I've seen online, depending on where you go with the hospitals, it could be anywhere from 50 to 150. Could even be up to $600 a night if you're going to a real 2-2 kind of hospital. but I think the Royal Phnom Penh only charges up to $150. So I would be out of pocket $100. No big deal. That's okay. Now, listen to everything that's fully covered. Will blow your mind. Intensive care unit limit and similar special medical units. Operating theater room charges. Diagnostic and investigation charges, including laboratory and scans, MRI, CT scan, PET scan, fully covered. Drugs, dressings, and other consumable charges. Physician and specialist visit fees. Implants and internal prosthetics. Treatment provided with the intention of relieving symptoms once your medical condition has been diagnosed as terminal. Up to 7 days take-home medications prescribed before you are discharged. Okay, maternity complications if you happen to be pregnant and on this plan. Emergency road ambulance, and a cash benefit for inpatient and cancer treatment, which is $40 per day, max 15 days. All right, now outpatient treatment, fully covered, surgical procedures, dialysis received, and cancer treatment. So now they had a clause about you can't have cancer when you first sign up, but she told me the way that works, let's say you don't have it when you sign up, there's like a waiting period of like 6 months, but then if you start treating after 6 months, then you're fully covered. So it's just the initial sign up period. It's not bad. Now, emergency care following an accident. Here's the deductible. She told me that if I'm in network, I only pay 10% of whatever the total bill is, up to a max of $500. So let's dig it. Let's pretend that the bill is $10,000, 10% is $1,000, but my max is only $500. That's all I'm gonna pay, and that is a yearly, or I'm sorry, that is per case. That's per case, okay. So that's not bad. Okay, let's look here. Oh yeah, and that's another thing, teeth are covered. So let's say you have an auto accident, you bust a tooth. It says that it says includes accidental damage to natural teeth caused by external, accidents and everything. Out of network, now let me first tell you, I asked her, I says, well, how many hospitals in Phnom Penh are actually in this network? She showed me a list, I swear, this long. There are a lot on this list, including the Royal Phnom Penh Hospital. There's only 9 countries that are actually in network, even though they have worldwide coverage. One of them's France, because they are based out of France. The other 8, we've got Cambodia, Malaysia, Thailand, Singapore, China, oh my gosh, and there's 3 more, but I'll find it for you. Just a minute, I can't think of them right now. But it's mostly, India, and there's 2 others, but it's all in Southeast and Central Asia. That's where they're all at. So if you have to go, let's say me going back to the United States, you gotta go back to the United States. Let's say you needed to get some help. Your plan covers you. But you have to pay 20% instead of 10%, and there's no cap. So let's say my health bill in the States is $10,000, which is very easy to do, and I got to come up with 20%. That's $2,000 out of pocket, but still not bad. Still not bad. Did I mention that you have to be in the country for 182 days? That's right, 182 days out of the year in order for this insurance to stay in effect. So even though it's worldwide coverage, it doesn't mean you can just hop on a plane and leave Cambodia and never come back, because it's based in Cambodia. So you have to be back. 182 days is 6 months and 2 days. Live in the country for 6 months and 2 days. Then you can go travel anywhere you want outside the country, still have coverage, pay for your premium. And here's another thing. They'll do monthly payments they'll do quarterly payments. You pay once every 3 months, or you can pay the whole thing at one shot, one annual fee. And I'm getting down how much I'm gonna pay. I'm just gonna tell you in just a minute. But I wanna go over the severe conditions, okay? These are like the exclusions. If you've already got this, there's gonna be waiting periods. So cancer, carcinoma, leukemia.
2 hours later.
Coronary artery disease, heart disease, diabetes, sclerosis, systemic lupus, something else I can pronounce, chronic obstructive pulmonary disease, or COPD, major organ failure, kidney, liver, pancreas, heart, lung, HIV or AIDS. Now, these are the listed conditions. Those are actually severe conditions, but if you list any of these conditions, I mean, they'll still take you, but again, there's gonna be clauses and waiting periods. So if you got any kind of tumor, breast lumps, malignant, skin tumors, cysts, nodules, polyps, whatever, ENT disorders and or surgeries, benign ear, nose, throat, goes on and on. Cataract, dilation and curettage, can't pronounce it. Fistula, fissure in the anus, and hemorrhoids. Kidney stones, ureteral stones, gallbladder stones, lithotripsy, can't say it. Surgery of something system, Jenna something system, we won't go there. All type of hernias, hysterectomies for hemorrhages, okay, well, we won't go there. Myomectomies for fibroids and arthritis, non-infective, osteoarthritis, osteoporosis, gout, rheumatism, spinal disorders, joints replacement therapy, and benign prosthetic hypertrophy. So all of those are going to have like little clauses. Okay, here's what she wrote. So important to know. Like most international health insurance plans, some points are important to know. Pre-existing conditions will be excluded for the first 3 years. There is a list of treatments and conditions which are excluded for the first 2 years. For the first 6 months, listed severe medical conditions are covered up to a limit, and childbirth is subject to an 18-month waiting period. Now, she said the waiting period above will be waived if you switch from a similar international health plan and you have at least 3 years of consecutive coverage and good health. So keep that in mind. Okay. And she says, please understand that the restrictions above allow us to design affordable and sustainable health insurance plans to cover your unexpected medical expenses. And that makes sense. Now, what did she quote me? I know y'all are dying, because I'm dying. I'm getting all of this coverage, $478.40 for the year. $478.40 for the year. That blows me away. The other guy was quoting me over $1,000 and higher per year. So what I'm gonna do is I told her, let me break it up in 3 because I'm like a little low on cash right now. I said, I'll pay you every 3 months. She said, cool. Gave her $170 down to cover for 3 months, got instant coverage. Like, I'm ready to roll, baby. So your girl is now insured, and I'm so happy. I couldn't be happier. So as you can see, healthcare in Cambodia is actually doable if you know the right people and the right places to go to. I'm gonna go ahead and put the information down below the video to let you know the lady's name and the place and everything, and her phone number and address. So if you come to Cambodia, you're gonna be armed and ready, and you won't be the guy on the news who lost his life savings because he got sick in Cambodia. You're gonna be the person in the know because your girl Tammy shared all the information with you, including Sherry. Shout out to Sherry. Thank you so much for sharing with me And everybody else on YouTube, we all appreciate you, because without this information, I would have never had the health insurance. Hey, if you want to know where to go and actually get your workout on, get your pump on for cheap in Cambodia, then you want to check out this next video.